Big hello to everyone who joined us. This is just a quick test to see if the sound is working. Please, we kindly ask for videos to be switched off as it affects the recording and the sound quality and the bandwidth. So please, if you could kindly switch off your videos. A big hello to Simon Blake. Simon, can you hear me? Perfect. We'll just give it 1 or 2 more minutes. We have over 300 people registered, so we'll start in exactly 1 minute's time. Thank you. So hello everyone, welcome to the webinar from UN Globe on Seen, Heard and Equipped. Our first session of 2. The first session is on emotional first aid, mental health first aid and well-being. A big welcome to everyone. Just before I start and introduce myself, I kindly ask all cameras to be switched off, please. This is because it affects the quality of the recording, as it will be used and shared for those who cannot attend. So please switch off your cameras. All your microphones are currently muted. Now, at the bottom of your window, you should be able to see a chat function. And currently, you are only able to send all questions to the host, which is Jen Rumbach. So if you have any questions or any technical difficulties, please send them to Jennifer, please. Again, a kind reminder, please switch off your cameras as it takes up and impacts the quality of the sound. Thank you. So we have our presenters available. So let me start with introductions. Hello, everyone. A big welcome to one of the first, and if not one of the many, webinars from UN Globe. UN Globe is the LGBTI interagency association group for LGBTI people in the UN system. And by people, it includes staff, junior professional officers, consultants, UNVs, and other affiliate staff boards. My name is Gachatan Sandhu. Most of you may know me as Nanu. I'm the president of UN Globe. It's a great honor to be serving on the board alongside a magnificent team, which is made up of Gabe Skelter, Sonia Donnelly, Jennifer Rumbach, and Sophie Brown. Now, today's presentation and webinar is about mental health and the impacts of just going to bring up my notes here. Okay. Now, the mental health issues of LGBTIQ people and individuals working in the UN are being compounded and magnified during COVID-19. In particular, for those colleagues, many of you who are working in duty stations in countries that criminalize LGBTI people or our existence. And there's many of you who are currently in isolation with homophobic, lesbophobic, biphobic, or transphobic household members, or with an abusive or violent partner. Now, our mental health services that are offered by our employers be what they can, they are trying, but not always tailored for our lived realities and experience, and therefore sometimes may fall short of meeting our needs. So we organize this webinars because of the uncertain and challenging times that this crisis has necessitated, that we have a discussion about the importance of our mental health and well-being during COVID-19. So for us, it's very important that we are being seen, that we are heard, and particularly for us, you know, that at the same time, our anonymity is also respected. So we have a great discussion today on the topic of emotional first aid, mental health first aid, and well-being. Now, before I go into introducing our panelists today, I need to say a few thank yous. I'd like to start off by saying thank you to Kaleidoscope Trust, to Jean-Miguel and Lady Phil, who helped myself and the team find the panelists for today. I'd like to say a big thank you to Toronto Mindfulness Centre, where one of our panelists come from, works for, Deepak, to Mental Health First Aid England, where Simon Blake also comes from. I'd like to say thank you to IOM for providing the webinar facilities for today. Thank you. And also to Jen Rumbach, also a board member, to whom you can send all your questions. Now, the idea of the setup of today is that there will be some presentations around 30-35 minutes. And the rest of the time, the remaining time, we will use for your questions. And those questions that you can send directly to Jennifer in confidence, and Jennifer will then collect all the questions and then put them to the panelists. With that being said, I believe Teresa Fitzpatrick is online. Teresa, if you can unmute yourself, and Jenna, if we can bring up Teresa's presentation. Teresa, are you there?
I am.
I can't.
Just let me bring my presentation up.
Okay. Perfect. Okay, so let me just briefly introduce you, Teresa. Teresa Fitzpatrick is the Global Mental Health Lead for the United Nations. Teresa's been on the implementation board for the UN system-wide mental health strategy. So, Teresa, over to you.
Excellent, thank you, and thank you for having me here today. Yeah, so I've been working with the UN for about 12 months now, after the UN System Workplace Mental Health and Wellbeing Strategy was launched just over 12 months ago. So we've been working at an interagency level to look at how can we improve the mental health and wellbeing of personnel across the UN system. And that came after a survey in 2015 which showed personnel within the UN had poor rates of mental health, had poor rates of seeking help, and there was poor levels of understanding around mental health and wellbeing. And that's across the board. So we've been working to really look at what can we do about that. There's 4 key themes of the strategy: looking at healthy workplaces. So how do we actually reduce the risk within our workplaces? How do we look at preventative strategies? How can we make sure the way we work, it doesn't have a negative impact on health? Making sure we support staff, so reducing stigma, ensuring we've got appropriate support and policies in place. We also have an advisory panel of people who have experienced a mental health condition that help us with every step of the way. We also look at the psychosocial services available. So there's nearly 200 counsellors across the system. There's a whole range of medical staff, nurses, but we do know that there's not equal access to that, particularly within the field. And also we need to ensure that any services that are available are quality and meet the needs. As you've already heard, we need to make sure that the services we offer and the strategies we put in place are actually relevant for everybody across the system. And also finally looking at sustainable funding. So for the last year, I've been the only person who's solely focused on the mental health and wellbeing strategy, but have support across the system for people who are working in this area. As you can imagine, once we hit the COVID-19 issues this year, we really need to stop and look at what's our priorities right now. And it hasn't really changed in terms of the areas we're working on, but it changes in terms of where our priorities are in the coming months. And the good thing about it in some ways is there's so much more attention around health and wellbeing at the moment. There's increased resources and there's increased capacity for us to really look at what are the specific issues that are out there and how can we start to address them. I'm just going to give you a really brief overview of what's currently happening. So we've launched a tab on the COVID-19 website that's available to everybody around wellbeing. We've got information there on working from home, on isolation, managing family responsibilities, promoting overall wellbeing and dealing with uncertainty. So the Secretary-General has also sent out a number of communications in this area, and really most of the UN organisations have got an increased focus on this at the moment. None of this information is particularly tailored, obviously, at the moment to the LGBTI community, and we're working with UN Globe to make sure we are meeting your needs, and if there's specific things we need to be looking at to work out how we can best do that. And obviously these webinars are a fantastic place to start. The things we will be looking at going forward, we are looking at increasing access to psychosocial services, and I'm in discussions at the moment to make sure everybody in the field has access to telehealth counselling where they need it, and access to specialised counsellors. We've already heard today there is an increased risk of domestic abuse at the moment, particularly with everybody working from home. We've got a specific reference group around domestic abuse. We've got an action plan that's been in place, and that's come about relatively quickly. So we'll be coming out in the next couple of days with our first communications for UN organisations, but wanting to make sure that everybody knows how to support somebody they're concerned about. So how to have a conversation, what can managers do, what can HR do, what can leaders do, and also if you yourself are experiencing domestic abuse, where can you go for help? And obviously it's challenging because it's different depending on where you are in the world. We're looking at all of the different resources and referral sources that are available and making sure people are aware of where they can go. We're also aware that there's an increased risk of suicide right now, and there hasn't been a lot of work done on suicide prevention across the whole UN system. There's almost been a fear of talking about it. So we will be launching very quickly some work around suicide prevention to make sure we do reduce the risk and make sure people do know how to reach out for help and colleagues know how to help somebody they're concerned about. Also looking at substance use, again, increased risk at this time, and not somewhere we've done a lot of work in, but we'll be doing some more work in that area, dealing with loss and grief. And that can be around loss of grief of a loved one as we go through this time, but also there's a lot of loss just in the changes in our lifestyle, in the fear about the future. And finally, we'll be moving to looking at once we go back to work, what's the transition process? There's likely to be a lot of anxiety, so how can we be providing the resources that we need? We have an email address, so happy for anybody to contact me. As I said, these are all quite generic resources, obviously trying to look across the whole system, getting those resources in place, and then we work to look at who are particular groups at risk and how can we be providing additional support for them. So I will pause there. Thank you again for having me today, and look forward to hearing your questions.
Thank you very much, Teresa. Thank you very much. We are, UN Globe is reaching out to Teresa and the Mental Health Implementation Board, and looking at how we can strengthen our collaboration and make sure that the voice of LGBTIQ people in the UN is heard and definitely considered. Now, before I introduce our panelists, I would like to note that UN Globe is a voluntary organisation, relies solely on the contributions of our members, and being a voluntary contribution, we don't always have the resources, in particular the financial resources, to cover our costs. So with that today, our panelists have kindly agreed to share their time with us without charging costs. So we want to say a really big thank you. I want to point that out. So a big thanks to Deepak Kashyap and Simon Blake for doing that today. Let me start by introducing Deepak. And just bringing up my notes, sorry. Deepak is a counseling therapist and life skills trainer. He provides emotional and mental health services in person and online for over 10 years. He holds a master's degree in the psychology of education from the University of Bristol. He's been formally trained in advanced programs. He's conducted workshops in India, Dubai, the United States, the UK, Europe, and across Canada. He's a published columnist in national newspapers and magazines, and writes about issues related to sex, mental health, relationships, and emotional disturbances. We also have the honour of Simon Blake, OBE. Simon is the CEO of Mental Health First Aid England, a social enterprise with a vision to improve the mental health of the nation. Simon's also the deputy chair of Stonewall. I'm sure you've all heard of the name Stonewall, a leading LGBTI charity in the UK. So with that, I'd like to hand over to Simon and to Deepak. And a big welcome again to all the participants who have just joined us. Thank you very much. Over to you, Deepak.
Well, thank you very much, Gurjatan, for that lovely introduction. I welcome everyone who have come here. I'll talk a little about myself and the work that I do, and then I'll hand it over to Simon. And after Simon's spoken, I'll speak my bit, and then we can go to question and answers, if that's okay with everybody. So I've been working in corporate mental health and diversity and inclusion initiatives around the world. I mostly have clients from various different English-speaking parts of the world, because most of my work is online, one-on-one counselling, group counselling, and couples counselling, and doing webinars like these. So today I think I'm going to be mostly speaking about how do we sort of accept what's happening, and how do we cope with it, and do we need to cope with it the way we think we do need to cope with it. So I'll be talking around a lot around embracing ambiguity and embracing fragility that has come to the fore in the light of all that's happening around us. And I would also be very briefly touching upon what can we do if we are quarantined with queerphobia of some kind, if we are quarantined with people who are queerphobic in many different contexts. So I'll just touch upon that as well. And if there are more questions around that, then I can take it from there. Over to you, Simon.
Thanks very much, Deepak, and thank you for inviting me to be part of this webinar. It's a pleasure, and welcome to everybody. I am just going to talk a little bit about the aim of this session, a little bit around what mental health first aid is, and then a few tips before handing back to Deepak. I think the really important bit for just to say is that this is a space, as the title says, for LGBTQI folk to be seen and heard. It's an opportunity to pause and take a breath, and to just think about your well-being, and to know that you're valued. And whilst we will provide some hints and tips in our introduction, and then give our expertise in the question and answers. It's not a training session, as such. This is really a space that we want to celebrate actually the communities and to benefit from that connection. And I guess just the final thing to say really is that our starting assumption is that we are adaptable and resourceful and have a long history of being adaptable and resourceful in the face of oppression, discrimination, whether that's at an individual level or systemic level. And whilst that doesn't make it any easier if there is, if you're experiencing that now, it's just important to remember that it is, we have a huge amount of power and resource, individually and across the communities. So mental health first aid, for those of you who are not familiar with it, is exactly what it says on the tin, really. In the same way that we think about first aid, mental health first aid is the immediate help that is offered to a person experiencing a mental health crisis or a worsening of an existing issue. And that sort of first aid is given until the point that there is more professional help. So mental health first aiders are people who are trained to know and understand the knowledge, have enough knowledge about mental health, about signs and symptoms, to feel confident having conversations about mental health with people, to challenge stigma, and to help people to think about what resources we have ourselves, what we may be able to get from support within our communities, family networks, religious affiliation, whatever it is. So thinking about ourselves and our communities, and then also whether there is professional help needed to signpost people into sources of whether that's health, clinical mental health support, or other forms of support, housing, etc. So mental health first aiders are not psychotherapists, they're not counsellors, they're not psychiatrists, they're not psychologists, they're simply people who are trained and able to provide immediate help and support and to challenge stigma. So if you want to find out more about mental health first aid, there is an international website which we can make sure you have the link to, because there are different organisations around the world that do provide it. And also, that wasn't me, there are also Mental Health First Aid England, which is mhfaengland.org. You can have a look. So just from me then, as an introduction, I think the most important thing that we have to do at this moment in time is to remember this isn't business as usual. This is not us just working from home in a different place. This isn't just everyday business, but doing it slightly differently. We are in the middle of a global pandemic, and with that there is heightened emotion, there is fear, there is anxiety, whether that's about health and well-being, whether that's about families' health, whether that's about jobs, money. Those things are out in the atmosphere. They're also inside of us, and so remembering to free ourselves from those expectations that we'll be able to do things in exactly the same way, to deliver as much, to achieve as much, and to remember that we will have ups and downs, and that is just an important thing to acknowledge. But I think some tips about how to help ourselves to manage in these situations. The first is obviously, we are humans, we actually like routines. Our routines have been disrupted. Many of us are on lockdown. So how do you create some routines for yourselves? And I know for the first couple of weeks, I would just find myself getting up later and later in the morning, from somebody who used to get up at 5 o'clock and go to the gym and various things before work, finding I was still lying around at 7:30. So I'm now getting myself out and getting into routine of doing a bit of exercise in the house before work, making sure that there's then time to prepare for work and to feel as though I'm going to work, and have moved myself into a different space. I'm lucky I've got space in the building that I'm in to be able to move out of the immediate environment. we know that we need to practice to connect with other people, that we need to really ensure that we are keeping those connections going. And Deepak will say a bit more about that in the context of if we're experiencing prejudice or discrimination. But whoever, whatever our circumstances, staying connected is important. The one thing that I would say is a month ago, everybody was really worried about staying connected. My own view is now we need to worry as much about disconnecting. The number of Zoom things that we can do in a day, you don't have to work all day and then do them in the evening and then do them on Saturdays and so we do need to think about how do we disconnect as much as how we connect. And then how do we practice self-care and create those moments of joy for ourselves, whether that's meditation, mindfulness, whether that's looking at new things that are growing outside that we can't see, can't go out and touch, or whatever it is. Really thinking about how do we practice self-care, learning new things if that feels like the right thing to do, or just accepting that our self-care is not doing very much other than getting up, putting one foot in front of each other through the day and releasing ourselves from some of those pressures that we often put on ourselves. And I would just say that having said we should do all of those things, it's important not to put those things, creating routines, being active, practicing self-care, on a list of things to do that we then beat ourselves up about if we don't manage to do them. Because that is one of the things that often happens. The things that we should do for our mental health become the very things that we actually end up chastising ourselves about because we haven't done them. So just, anything goes, eat, whatever it is, just do the things which help you to manage the days. Second then, and again, Deepak will say a bit more about this, but just remember that our feelings are just our feelings. What we feel are the things that we feel, that we can own them, accept them, notice them, enable ourselves to not feel worried that we should be thinking something else or that we could be thinking other things, that we should just allow ourselves to have the good days, have the bad days, have the negative feelings, have the positive feelings, and to also to name them for yourself, to understand what's happening with ourselves, because that will better help us to navigate our way through and ensure that we keep on having the resourcefulness to be able to help ourselves to put one step in front of the other through this process. I would just to say again, disconnecting is as important as connecting, and we really do need to allow ourselves, our brains to rest. That's the most important thing about this, that eating, sleeping, exercising, not drinking too much alcohol, ensuring that we're drinking a lot of water, all the things which look after our brain in order that our brain can look after ourselves, and disconnecting is an important part of that. Thank you. Deepak, over to you.
Thank you, Simon.
Thanks a lot, Simon. That was absolutely brilliant. I couldn't have put it more succinctly myself. That was brilliant. So I think you can also check out some of these resources on Toronto Mindfulness website. I think what I'm going to talk about is the nature of worry. What is worry? Understanding that. How do we embrace it? And what do we do to sort of cope? Because there's been a lot of conversation around, how do I wrap my head around this? How do I cope with this? And how do I lead myself out of this hole that I haven't dug? What if I say you don't have to cope with or understand it fully? At least not to the point that you think is necessary to lead yourself out of this crisis. A lot of the times we end up thinking that, I have to do this and I have to do that. Maybe sometimes you don't have to do much. Regardless of the office and the importance that we hold in our jobs, we all have to process this crisis at a personal level. Self-leadership in times of public crisis requires different perspectives and maneuvers completely. So a lot of the times, we are thinking about worry. We don't even know what worry is. Worry is a very uniquely human thing to do, right? Because we can imagine future. We're the only species who can imagine future to the extent and scope that we do, or at least we know of. So what that means is we can imagine the future in multiple ways, in many, many ways. And it's really hard for us to not imagine a future which is negative at the moment, or at least challenging at the moment. But at the same time, imagining a future that is constantly the worst possible scenarios, constantly in worst possible scenarios, is what is problematic. Imagining a future in which you might get a disease or might get this, might still be able to tell you, you know what, wash your hands and eat right and do this. But if you constantly imagine a future in which you are falling sick, in which you are not able to deal with stuff, that is going to wear us down. So I have a few suggestions to make that we can talk about how to cope with this. Is first of all, limit your time consuming information about COVID. Because if you think that I need information every day, all day, I think too much and repeated information is not going to make you any expert on this matter enough to deal with or control the virus. It just won't. And accurate and brief information once a day is sufficient for you to keep yourself and your family healthy, I believe. The second thing that we have to also think in terms of three things, I think. The thoughts, feelings, and behavior. What are we doing to sort of cope in terms of thoughts, feelings, and behavior? Now, when it comes to thoughts, now this is actually slightly controversial, but very important. That whenever anything is new, ambiguous, and unpredictable, when we don't have any prior reference to it, when we do not know how which side the camel's going to sit, we do not know what the outcomes will be, and it's open to ambiguous interpretation, whether it is conspiracy theories, whether it's bioweaponry and whatnot, we can spend a lot of our time in either fighting or fleeing the situation. When all that, sometimes as Simon said, sometimes all that we need to do is just look at the situation and say feelings are just that, feelings. Whenever we as human beings are revealed to ourselves in our fragility, what we do is we tend to fight and flee. And it's a very human thing to do. And just because it's a human thing to do, that doesn't make it the most functional thing. I think the premise that I'm working at is that there are better and worse ways of facing calamities that are unavoidable. You can make something better or worse by thinking a certain way about it. So, for example, if we keep thinking in shoulds, demanding shoulds, life should not be hard. I should not be worried. Sometimes I'm worried about being worried. So removing that sort of second layer, there are ways to interpret disasters that would add a whole new layer of pain or suffering on top of them. So then the second way of thinking would be, I can't deal with this. I can't deal with this. I mean, of course, you can't deal with everything, but you could be able to tell yourself that I can deal with not being able to deal with this at the moment. I'm not required to deal with everything every time, but I can deal with failure of dealing with it. I guess what I'm trying to talk about is that when we are feeling weak and fragile, to embrace ourselves. The kind of public leadership models that we have in front of us, especially around leading groups of people, is information and control, and that's why we try to learn as much as we want to be able to control the situation. But in situations like ours, the ones that we find ourselves in at the moment, we can't control it. So we have to embrace it and accept it. And I think that is one of the points that I'm trying to make. The other thing is, however counterintuitive it might sound to us, it is quite possible that we might be exaggerating even in the face of a pandemic. So we might be, saying, there are ways to meet and greet catastrophe without catastrophizing. So these are some of the ways in which we are thinking that might be, so demanding nature of thinking, saying things like, it always happens to me, it never happens, I never have good luck, and things like that, and I can't deal with things. So these are some of the ways in which we think that might undermine our own capabilities to sort of cope at the moment. Then, when it comes to behaviors, as Simon pointed out, there are behaviors, even if we've never questioned them, there are behaviors and narratives on which we base the structure of our life, which organize our lives. We may never ask questions like, is there a God? We may never ask questions like, do governments know everything? And things, all of those. So whenever we are faced with challenges that sort of question our structures and the narratives that we've organized our lives around, it's hard. It's hard to deal with that. And in the place of that, we need to create some flexible, non-punishing structures, like, as Simon said, routine. I would also say, you could pick a friend and say, listen, we're going to have a dance party. You could put one music and select like the gayest, the queerest song that you know, and just dance to that together. Or you don't even have to dance with other people. Just dance on your own. Dancing is a very good exercise to sort of regulate for emotion regulation. And I cannot stress the importance of mindfulness meditation at the moment. But try to not, if you do not have any experience in meditation, don't try to do it on your own. There are many free YouTube videos. There are many applications for your smartphones that you can download that will take you through guided meditations around these things, and try to go after the ones that are slightly more secular, the ones that talk less about the spirit and the God and whatnot. And I have to also come out with my personal bias. I'm an atheist, so it doesn't really matter to me as to whether they're talking about spirit guide or not, whether they are able to keep you in the present. And the only way we can stay in the present without chemical intervention is through our breath and our body. You can never have a past breath, and you can never breathe a future breath. The breath is always in the present. And so is your body. You can't have your five senses operating in the past or in the future. It's only your imagination that goes into the past and the future, the past and the future, regretting the past. I wish I had saved enough. I wish I had stocked food enough. I wish I had done that enough. Or what's going to happen, what's not going to happen. So it's only our imagination that can go in back and forth. Is through our body and breath that we can stay in the present. And that is the emotional care that your brain needs at the moment. And I think I would like to end with, like to conclude my part of the conversation by saying that joy is only but one emotion. Let's not make joy a burden. You don't have to be happy all the time. Joy doesn't have to be a constant. There are other emotions that are worth exploring. It could be sadness, it could be anxiety, it could be any other emotion other than joy. So I think we should not privilege joy just as an emotion over anything else. And I think that would make us grow as human beings and as individuals. Over to you, Gurchattan.
Thank you. Very useful insights, and thank you very much to yourself and to Simon for sharing what we need to do. And I think, Simon, going back to you, I think summarizing, the key thing is to disconnect. In a world today, even now, we're so sort of hyper-connected, perhaps too much so, we need to learn how to switch off and make that distance. And the message I think I get from the key message, or the central message from you, Deepak, is it's okay to not be okay. It's okay to not be okay. Let me sort of kick off some sort of questions, and I think perhaps more to in bringing it into the context of a lot of our members. And please send in your questions to the host directly, and Jennifer will post them to you. But let me kick things off. In our situation, I think a lot of UN workers or people that come to UN want to come in and want to make a difference, want to make it, or that's their calling, and it's part of their reasons why they join an organization like the UN. So we have a lot of empaths in the organization, and then, but how do we then, as sort of empaths or very altruistic people, take care of ourselves first as well? I think, how do we factor that in? And I think the other part is, how do you also disconnect? I think maybe this is going to be coming next week when we talk about creating safe spaces. And perhaps this is more to you, Simon, is how do we disconnect, but in a space which is already hostile? For example, many of our colleagues may be in a duty station where, as I mentioned at the beginning, where being LGBTI is criminalized, or they're at home with, and they're not being able to be themselves. And they may be with household members who are homophobic, or they just haven't come out. And that UN office or that work area was the one place where, despite the national laws, they could still be themselves. So how do we sort of disconnect in that sort of environment? So two questions. One is, how does an empath or an altruistic person, a lot of people like that in the UN, switch off, disconnect? And then how do we disconnect in a space which is already quite possibly hostile and aggressive to our very existence? Please feel free to for participants to send their questions through.
Deepak, shall I go first and then you, or do you want to go first and then I'll follow? Which?
Yeah, no, you go first and I'll follow you. Follow your lead.
I think the first thing that anyone has to realise is that we're no good to anyone if we are ill, and therefore looking after ourselves is, in Audre Lorde's words, an act of radical self-preservation. And it's really, really, really important that we recognise that we have no sense of how long, and that will vary depending on where you are, but that we need to be well, we need to look after ourselves, and burnout, stressed out, just isn't going to be any help to anybody. So that's the first thing, that we do have to look after ourselves before we can look after anyone else. I think on the second, this is really, seems to me, it follows on from Deepak's point about breathing, that you can't breathe in the future or in the past, you can only be in the moment. But disconnecting is finding ways that work for yourself, and finding ways to draw on the resources using mindfulness, meditation, doing a jigsaw, whatever it is, but recognizing that the circumstances and the environment, if they are hostile and it isn't possible to disconnect online and go into other spaces, is how do you draw on the personal resources which you've got, and that may involve using helplines, using support networks, but finding the things which disconnect may be the wrong word, maybe it's decompress, and finding ways to do that. Disconnect again starts to set a thing that we have to do, which is to turn things off, but the thing we have to do is to find ways to enable us to rest to recuperate, and that will be all sorts of things, different things for different people.
I completely agree with you, and I think just saying what you said just using different words. So addressing the first question about the empaths, realizing that self-care and caring for others are not part of a continuum, but a circle. And they shouldn't be pitted against each other, because we sort of we've been raised in a culture that thinks that if you take care of yourself, if you put yourself before others, you are somehow bad. And in any context, if we see that we, as Simon said, we're no good to others if we are not taking care of ourselves. So putting that perspective on it, that it is a circle and not a continuum, so that's one. Quarantine, when you're quarantined with people you're not necessarily feeling safe with, here are some of the practical things that I think you could do. First, learn to walk away from arguments. You have to assess your own personal safety, emotional and physical. And I know, like, a lot of our trans friends, for example, will be misgendered. A lot of our gay people would be invalidated. A lot of lesbian people would be feeling, unsafe. And we can go on and on and on. But at the same time, your body, your existence matters more. And these are all really valid battles, but we have to choose the battle that we want to fight at the moment. So try to move away from the arguments when you think the arguments are starting. Second, kind of have assertive boundaries with people when you're isolating with them around personal working spaces and me times. If you do not want to be in touch with somebody, talk to someone, it's okay to tell them that, I'm just taking this time for myself. And if that's one thing. And it's also, these are just general things. And I know not a lot of people have the privilege of having big enough houses to have me spaces. I am fully aware of that. So just take what you can from this and discard what you think is not applicable to your particular situation. I would say make sure that you are mindful of other people's schedules around, using the television, the bathroom, and the other resources in the house. So basically avoiding every chance of a conflict. If conflict happens, it happens, but trying to not be in a situation which could become dangerous for you. Ask them if they want you to do some chores and if the household chores can be shared and what is expected of you. So have an open communication as to what's expected of you and what's not. All of these things reduce chances of having confrontations and conflict. And then I think why it is really important to have me time and connect with yourself and everything, make sure that you are in touch with somebody whom you feel safe with, whether it's online, whether it's on the phone, whether it's on video. So just being in touch with one or two people that you feel safe with, who you're close to, that could sort of balance things out a little, and sort of explore the idea, why do I have to be a certain way all the time? What is the demand that I'm putting on life? Because life seems to be very incapable of answering to our entitlements around these things.
Okay. All right. Thank you very much, Deepak. Thank you. It was very, very useful. Very, very useful. So I'm going to turn to Jen now, but just before I do, for those who may want to ask questions and it's not clear to you, there is a little button, or there's a button at the bottom maybe in your screen which has got a sort of a speech bubble around it. If you click on that, a window should appear on the side or the right hand side of the screen, and there you can send all your questions to the host. Please don't send them to everyone, but just to the host, to Jen Rumbach, and ask you a specific question there. Before I turn it over to Jen, I do have perhaps one question, is how do, and I think perhaps it relates to your sort of disconnecting the idea of disconnecting. How do we take care of ourselves with at the same time when we've got family members who may be in hotspots? You know, we may be stuck in one duty station or one part of the world, and we're not able to travel. We have parents who are very vulnerable or loved ones who are vulnerable in other parts, and we're constantly checking the news. You know, how can we reassure ourselves of that safety, that they're okay as well, but at the same time be able to continue for the functions? I mean, I'll give you my example. You know, I've got parents in the UK and they fall under the vulnerable category. And how do I make sure that I'm taking, at my same time, I'm able to take care of myself, but also that they're okay too? Over to you, Deepak and Simon.
You can't make sure of it 100% of the time. Just tell yourself, if you're doing what you can do, then you're doing what you can do. And it is very understandable to have this human desire to do more than you can. But that if you could do it, you would do it. So I think, you know, sort of, it's very seductive to blame ourselves that I'm not doing enough. It's very seductive to guilt yourself into self-loathing of not being enough. And specifically with queer people, we've struggled with this our entire lives. The feeling of not being enough, the feeling of not being good enough. So I think particularly with us, we have to sort of go past that seduction and say, listen, these are the actual things that I can do. Make a list of the actual things that you can do. And then tell yourself, am I doing those? And then ask if you're doing those, then you're doing those. And then also make a list of the things that you think you should do, but you cannot. That's also important. And then you tell yourself you cannot. Because telling yourself that you do control, you are in charge, is actually going to make you worry a lot more and won't even let you do the things that you actually can do. Simon?
I would just add to that. So I think it's interesting how it can also feel amplified if you're in a different country. So I'm in the same country as my parents, but I'm 250 miles away, and I wish I could do more. But I also have the same conversation with people who are 3 miles away from their parents who can't do anything because we're all, you know, in this lockdown environment. So I think, as exactly as Deepak is saying, there is accepting the situation, working out what you can do, and then accepting the things that it's not possible to do, but also perhaps just checking whether distance feels like it's amplifying some of those anxieties at this point, that you could be 300 meters down the road and actually still wouldn't be able to do anything more. I know when I worked overseas, I would sometimes feel guilty when I couldn't do things because I wasn't close enough. In this circumstance, it's nothing to do with close enough because we just can't be there. Yeah, that's the situation we're in.
And I completely understand the chat. I think sorry to cut you there, but I just wanted to say that I do empathize with the fact that your distance from your parents does give you an extra layer of feeling that I don't control the situation. But the thing is that we never would be able to control the situation even if we were there. I mean, you wouldn't be visiting your parents, given that, I mean, your age, I'm guessing you're not about 60. So you wouldn't be visiting your parents who are about 60. So it is difficult, but we have to sort of say that, listen, I'm doing what I can.
Okay. Thank you. Thank you very much. That's great to, thank you very much for those very helpful points. Jennifer, over to you for the questions that we received from our participants. And again, thank you to everyone who's participating today. Thank you.
Thank you, Nanu, and thank you, Deepak and Simon, for your presentation. I have a few questions. I'll start with one that is about LGBT couples who are in the UN and who are currently separated. The person asking this question says, I'm in New York. My partner is in the Middle East. She's also Middle Eastern. We haven't seen each other in 3 months, and we do not know when we will see each other next. We used to live together in New York, but she had to go back. So this has been a massive change, a lot of feelings of uncertainty. What do you recommend in this particular situation?
So what has happened is that you've been now forced to be in a long distance relationship with someone that you were living with. And it's very unfortunate. But when I say it's very unfortunate, I don't mean to dismiss it with a but I think what I'm trying to say is, while accepting that it's hard and it's unfortunate, accept that you are living in a world where you still can get in touch with your lover who's on the other side of the world, compared to somebody maybe even 10 years ago when there weren't any options. So, and this is the advice that I've been giving to almost all of my couple clients who've been separated because of COVID, is depending on how much do you trust each other, bring the same creativity that we talk about in every other areas of your life to your romance and sex life. How much can you, first of all, how much do you trust that person enough to be romantic and sexual online? Because, I mean, this is just a disclaimer, people who try to be sexual with people on video online, you always have this risk of being recorded without your consent, or if you're sexting with somebody, the risk of being taken out of context and your text being published, that's always present there. But explore these fields with the person and see what you can get connected on. Second, do similar activities, assign yourself similar activities like, hey, I'm going to watch one episode of such and such, and you watch one episode of such and such, and then we'll talk about it, or we'll read a particular chapter of a book. It's basically like creating a sense, if not an actual practical or reality, creating a sense of doing things together. And that's the best that you can do at the moment, but if you think it's getting too much and you want to take a break, that is also a possibility. But if you're married with each other and you know you're very much into each other, I would say suffering this thing together is actually going to bring you together, because the idea is that right now you have shared vulnerability. You both are vulnerable, and vulnerability is the prerequisite for connection. So don't look at it just as a negative thing alone. It is negative, but it also has possibilities of a deeper connection.
And yeah, I would 100% agree. I guess the principle underpinning long-term relationships really is, how do you keep the connection and keep the intimacy? And however that is, whether that's, I understand that you can do Netflix and watch the same program and chat to each other online or something. I've not done that, but there are ways of, how do you create that feeling of doing the same things, connecting, having the intimacy, an intimacy in its fullest range, from whether you would cook the same meal and eat it at the same time, but happen to have it on WhatsApp video, so that you create that sense of having meals, and obviously there's time differences which impact on that. But do all you can to create the intimacy and some routines and just the normality, but also to feel okay about talking about the emotions and the feelings that you're having in relation to being apart.
And I say that as somebody who had been in a long distance relationship. I was in England and my partner at the time was in India, and it went on for about 1.5 years like that. So I do have some experience, personal lived experience around the question.
Okay, thank you for that. We also had a participant share an article in the chat that they said they found really helpful about how to maintain relationships in self-isolation. So I'll share that with everyone in the follow-up email to this webinar. The next question is, the participant said, I'm a very sensitive person, I'm gay, and in December 2019, I broke up with my ex and I now live alone. It's just making me more anxious. Lockdown has more effects on me. Any tips, please?
Simon, you want to go first? I can't hear you.
Sorry. Can I just check I heard the first bit? A separation in December 2019 and that being in lockdown is making the person more anxious.
Yes, that's right. And do you have any tips to share on managing that anxiety?
Sure.
Related to being alone?
Yeah. I mean, I guess, again, it's finding the things that work for you. For me, whenever I feel anxiety, I use a very simple breathing mechanism and routine. Whether I'm out running, where I often get anxiety because my brother died of a heart condition, and so sometimes if I get out of breath, I get some nonsensical, in logical terms, but real anxiety. So we'll use breathing routines in order to try and manage those particular situations and times where it feels acute. I guess, again, the things which we know people are using in order to manage anxiety on a daily basis as general feelings of anxiety is, one, to accept it and to acknowledge it and to own it and to notice it, to then be clear whether there are particular times or things that trigger, to think about whether there are particular things that are helpful. Some people we know will write about it and keep a journal which enables them to do so. We know that gratitude and practicing gratitude to help to focus on some of the positives. So all of the things which would ordinarily recommend are absolutely the things which I think are really important to bring into life at these moments. And again, I guess it's you may be in isolation in terms of physical isolation, but how do you keep the connections which enable you to not feel alone if you believe that this is very much connected to being alone? So how do you get that feeling of being connected, getting support, and remember there are in different countries, and of course with the internet, often things transcend country boundaries, but all sorts of organisations that provide support, whether that for anybody that's feeling in emotional distress, or indeed as ways of building in, getting onto community forums, etc., as ways of supporting one another through some of these processes.
That's brilliant, Simon. I think I have 3 points to make around this. Whenever we go through a breakup, whether it's in pandemic or not in pandemic, first is there's a shaking of a sense of self. Who am I if I'm not their partner? Who am I if I'm not their boyfriend, girlfriend, wife, husband, even friends, sometimes when we break up our friendships. So the idea is that a lot of the times when we are together with someone, our sense of self, our sense of identity get enmeshed with theirs. And when we separate, there are frayed ends as to where do I attach these to. And so that's what getting closure means. Like how do I get closure from a person who's gone? I do not know how to meet them, and I'm going to assume that this person is not talking to you or you're not in touch. So one of the best ways to work towards getting a self-closure is writing physical pen and paper letters to them, which you will never post. Writing what you wanted to say. Expressing in and of itself has a lot of therapeutic benefits. Make sure that you do not type, because when you type, it's so easy to just hit send. You do not want to get in touch with them again, because that solidifies the idea that you have to get a sense of self through them. So my second point around closure is write as extensively as you can around what you're feeling. And once you have your thoughts on the paper, then look at them and say, then think about that thinking. Why am I thinking this way? The third thing that I will want to say is reinterpret your anxiety as normal and natural. Do not be afraid. This is not the time to run away from anxiety. This is the time where your posture towards your pain has to be one of welcoming. It has to be a welcoming posture towards your pain. Because a lot of the time when we're anxious, we close up our body and we take smaller breaths as to, what's going to happen? Where am I going to go? As opposed to that, very consciously elongate your breath, open up your body every time you're feeling anxious. And you might feel anxious around a certain time of the day, where it might be waking up in the morning or towards the evening. So just prepare yourself around that time to elongate your breath, come back into the present and say, you know what, anxiety, and you could even silently say this in your head, anxiety, I welcome you as an experience. And so writing letters, thinking that you're still a complete person and you have an intact sense of self, and welcoming anxiety, I think these are some of the ways that you can deal with a breakup in isolation as well.
Okay, thank you. The next question is, what are your recommendations in the event someone experiences gender-based violence during quarantine if they're in quarantine with their abuser?
Right. Call 911. Really, if it's a physical violence, I mean, pandemic is no excuse for bearing such violence. And of course, I know it's easier to say than done. I mean, police services have not stopped working. Look up shelters that you could go to if you are indeed in a place where you could go to a shelter. But I'm guessing most people on this call would have access to some kind of help from the police in their area, if not necessarily access to shelters. Do not think that just because the world is right now not functioning the way it normally does, that means our human rights, our sense of, sense of propriety and morality have completely gone out the window. So there are certain things that are functioning the same way. And yes, police is occupied, but at the same time, no one's going to say no. And Simon and I were talking about it, that the domestic violence, intimate partner violence rates have gone up both in North America and in the UK, and significantly so. So I would say, please do not ignore that, because if you are stuck with the person who physically assaults you, then that is a line that you draw.
I don't have anything to add. I just think it's really, really important that to remember that the rules and our rights still apply in this time, and recognise it's really, really difficult to be in that situation. But it's getting the help, getting the support from police and others is important.
You still miss her.
And Teresi, I'm just jumping in, and also be aware that there's a lot of resources within the UN system. So reach out to your organisation's counsellor, the Ombudsman, HR. So there's a lot of resources that are available within the system, and we'll also have information on the website coming out of it.
And I'll also note that you can reach out to UNDSS in many of the locations where we are. And the next question is from the perspective of a trans person. How do you accept and internalize that if you're diagnosed with COVID-19, medical treatment might be out of the question for you because hospitalization, et cetera, would certainly out you as a trans person in an environment where it could be dangerous. And of course, traveling for medical treatment is no longer an option. So for example, you're having to choose between the risks and dangers of being outed in a hostile environment and the risks and dangers of avoiding medical treatment in favor of self-isolation and self-treatment.
I mean, there is no easy answer here. I think is the most important thing to recognise and to say. And clearly, COVID-19 is impacting different people differently. So, yeah, there is a very mild version of COVID-19 in which there is a choice. Yeah, that lots of people are experiencing that doesn't require medical intervention, and then there is life-threatening and disease which people are dying from. And so those risks and the options are obviously very, very different. I guess the thing which I say I say with full understanding of the gravity of the decision, but the medical professionals have a duty to every single one of us and a responsibility to every single one of us. And every single person deserves to get care which would protect them both from COVID-19 but also from harm as a result. And I recognise that won't always happen, but there is, if that is a real concern at this stage, I think the best advice that I could give is to talk to the support that's available through the UN in really understanding what is the best way that you may be supported, privacy protected, in the event that you did need to go into the hospital. And Therese just talked about some of those those supports that are available and may be able to recommend something some specific within the UN system that can help. But I think it is the really important thing is to be clear that every single person deserves and has a right to medical care that protects them emotionally and physically. And I'm sure that your colleagues within the UN would want to help to ensure that that was a reality as much as it was possible to do so.
And I think at the end of it, it also is answering the question of the cost and benefit analysis. And of course, just adding to what Simon said, depending on how severe your symptoms are, whether you can stick it out at home or do you need a ventilator. So if you need a ventilator, then the cost and benefit analysis of, hey, I can, and I say that as a cisgendered man who's never experienced any gender-based violence. I've experienced a sexuality-based violence, but not gender-based violence. So I say that as a disclaimer already, that I recognize that that is a gap in my experience and hence in my knowledge around these things. But having said that, hypothetically imagining if I was afraid of being outed, what am I more afraid of? Dying without it or being outed and being mistreated? If you're still alive, we'll deal with you being outed and mistreated later. Because first is your body, first is you being safe. So the assessment of a cost and benefit is assessing how safe do we want to keep you first. So if you're alive, we'll do everything else later. So you come first, even before your identity for you. Your identity is because you exist. So let's just maintain. Let's try to have you continue to exist in the face of this pandemic first. I hope that makes sense.
Several of our participants also noted that, our organizations have, I think one participant put it really well, that they have a duty of care that cannot be renounced because of COVID. So, of course, your employer should be involved. In some cases, medical evacuation or high-level intervention could be required. So, for instance, the resident coordinator getting involved. But I think if if your local office is aware of your trans status, of course, that might be another complicating factor, but they should be stepping in and assisting you as well. Okay, the next question, switching gears here a bit, is about using dating apps during confinement. The question is, can using dating apps during confinement without meeting someone in person be a healthy way to combat isolation, engage with the LGBTI community, and maintain some semblance of a romantic life? Some apps are temporarily allowing you to override GPS settings to, quote, relocate, for example, from a non-LGBTI friendly geographical area to a more vibrant one. Or is this likely to make you feel worse in the long run?
I mean, my simple answer to that would be everyone is different. If dating apps are something that you would ordinarily use and think that they will bring value, then use them. If not, then don't. I just think there is no one answer to this. This is a bit again of Deepak's. I think cost benefit is always a really useful way of thinking about anything. What might be the benefits of this? What might be the costs of this? If the costs outweigh the benefits, don't do it. If the benefits outweigh the costs, do it. If you're not sure, depending on the type of personality, taking the choice to do it, and recognizing that there might be some you might wish you hadn't afterwards, might be a greater risk, a better risk for you than not doing it and not getting the benefit. So it definitely isn't a single answer.
Right, and as mistakes are always decisions gone wrong in hindsight. I mean, nobody sets out to make a mistake, to commit a mistake. So I think the cost of, now let's see what could be the potential costs and benefits around this. Benefit is that you could get a pen friend. A lot of people used to do this even before the pandemic, talking to people they knew nothing about but had something in common with. So getting that. The cost could be falling in love with the idea of person that you have created in your head. Because when you're not physically with someone, you do not know what irritates you about them. You do not know how lovely they are, how annoying they are, and all the rest of it. So your imagination starts filling up gaps for these people. I mean, there are enough research to say that a lot of the times when we just look at people's pictures, we start imagining things about them. Oh, he has a kind face. Oh, she must be very lovely. Oh, we do not have that information. But our imagination is filling in the lack of that information, because that's how our imagination works. So as long as you're doing it to actually get to know the person, to actually get to have like video chats with them, get to know them and blah, 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 but still being cautious that it's all online. Still telling yourself that, listen, I'm doing this to actually, so the benefit is you could actually increase hone your romantic skills to talk to people, to get to know more about them. But the cost could be that we might be raising our hopes on very little premise. So these are some of the costs and benefits that we could be aware of. And at the same time, I mean, even in person, loving someone or dating someone is a form of risk, is a form of personal risk that we undertake. So those are some of the open-ended statements that I'd like to leave you with around this.
Okay, I have a comment from a participant. They said, thanks to Deepak for his honest comment on secular meditation and self-disclosure as an atheist. It can be such a taboo, and the messages we get can be so fluffy, quite like the notion that breathing brings you to the present. And then related to that, I have a question. Can the panelists suggest websites for guided mindfulness or meditation?
I would say I personally follow two applications. One is Headspace, and the second is Waking Up Podcast. But Waking Up is also the name of the app. It's the Headspace is by Andy Puddicombe, And the next one, which is 10% Happier, is by Dan Harris. And they're all secular platforms to learn and practice meditation. And if you want to go or not download an application and just want to go on YouTube, then you could just search for mindfulness-based meditation from Oxford University, Oxford Summer School, or Cambridge, or any other reputable organizations that sort of keep it as academic as possible.
I use Headspace. I also use a guided Wim Hof method breathing, which you can look on YouTube, which is WIM and then HOF method breathing. I can send the link through so that can go in any information afterwards if that's helpful.
And just Therese again, so a lot of the UN staff have access to Headspace. So I know certainly the Secretariat does have license that are available if you would like to access that. And we also have some guided meditations on the COVID website as well, that everybody can do.
And Headspace I find is really useful for sleep in particular. So for anybody who finds going to sleep is a moment where you could do with some guided meditation. Headspace has got some great ones on there.
Excellent. And one of our participants said, FYI, for UNICEF staff, Headspace is free for 2 years. So definitely check in with your own agency and see if you have free access to Headspace. I'll also note that 10% Happier is doing a free meditation every day that's live. It's at 3 p.m. US Eastern time, but they then record them and they're available on YouTube. Also, Insight Timer was mentioned by one of the participants as a free database of guided meditations. And then also someone said Headspace is also free for OCHA. Okay, so the next question is, any tips for managers or coworkers on how to do mental health check-ins with team members and colleagues, making the check-ins feel organic and not forced, considering that this has to happen virtually, which already decreases the natural and organic aspect of the interaction? We use video calling is obviously the best because you will see the visual clues as well. But we at MHFA England use a single question, which is how are you and what are you doing to look after yourself? And the clue is not in what people say on one day, but how it changes over time. And we know that people will often stop looking after themselves when they are not well, and it's that bit of noticing the different things that people say and then being in a position to hold a mirror up. And we do that when we were face to face, but equally doing it whilst we are working remotely. But also, I think the bit which I would just say is there is a slightly different way that we're doing business at the moment, which is that we spend about the same amount of time in a meeting, but more time of that is on how people are, what they've been doing, and then reaches the decision, the business piece of the meeting in a shorter time than you might ordinarily do. And I think that that's really valuable, that that there is more time being spent. And I think one of the positives that we've really seen over the last month is that everybody is talking about mental health. People are naturally and intuitively checking in more, and people are naturally and intuitively responding more openly about how they are, because we are all perhaps a bit more tuned to how we are feeling. So my personal view would be, whatever question you choose, have a similar one so that you can see how people are responding over time, because it will be changes, but also use the time to check in with your teams and individuals and spend more time on it, even if that means that you've got to then squeeze the decision making, the outcome piece of the meeting into a slightly shorter period
in order to fit in that time, thinking about how people are.
So, Simon, sorry, were you done?
Yeah.
Okay, fantastic. It's good to know that I was not cutting you. Right, so the first, I'd say 3 things, particularly for managers, because at corporate, as the Director of Corporate Mental Health, this is the work that I am having to do, I think, from the end, like the beginning of March. This is what we've been doing. So the first thing is make sure that it's very casual. Like, make sure that it doesn't have any wordings around like, oh, mental health, this, that. No, it's just a casual hangout, right? So that because regardless of how enlightened we think of ourselves, there are stigmas attached to words, and we all respond to those stigmas. Then I think having a casual hangout, asking people for one question. What do you think is your funniest coping mechanism to deal with this? Asking this question, like, what is the funniest mechanism? And for that casual hangout, you also have to, like, you could also suggest, not have to, look at me going have to and should. It could be useful for us to say, hey, could you all bring a funny meme or a funny video that you'd like to share with all of us around our situation or just in general? So something like that. But the disclaimer is it could open doors for some people sharing something that's offensive to others. So just make sure that that sort of goes out to people that, listen, let's share only things that are non-discriminatory, the things that are not potentially, or you could send it to me and we'll vet that and things like that. It's not necessarily censoring, but being aware that we're already hyper vigilant and we are all like raw, we're feeling raw emotions, and it could trigger something. But I think it's worked really well with my team, that we just hang out sometimes and talk about anything and everything but COVID. We talk about like, oh, my dog pooped on my carpet and this is what I did. And it's basically still saying that with all these big problems, I still have these tiny little problems that I can count on to keep my life as usual.
100% agree with that.
Okay, we have one last question for the panelists. This is about the subject of control, which I know you addressed a bit before. The participant says, as a project manager, I'm used to managing. I think the worst thing here is not having any control over what's going on. It's tiring to set up constantly the different options I have with my projects and then canceling them, rescheduling them, etc., on which I don't have any control on in the end. Anything else you can recommend to deal with that frustration in the work setting?
Shall I start, Deepak? Do you want to?
Yes,
yeah.
You go ahead.
So I hear that frustration. So as chief exec, we had a really nice business plan that we were going to be delivering from April the 1st, 2020. And we've had to rip it up in its entire pause. We haven't ripped it up. It's still there. But completely put on pause and agreed 6 objectives for the organisation, which are different than the ones which we had in the business plan in order to work through. So I guess my advice to anybody is to be really clear what the objectives are for now, in order to free yourself up from trying to deliver what you were trying to deliver pre-COVID. I personally would not rearrange things until you're clear about whether they can go ahead, or be clear what absolutely has to keep being arranged. So really finding ways to ensure that you are not working really hard without end game, and minimizing that rearranging, redoing, rearranging, redoing. So we made sure that we're not rescheduling any of our training until we're face-to-face training, until we're sure that we're able to reschedule it, because we rescheduled once and then have to reschedule again. You know, people are doing the London Marathon for October, but today Oktoberfest in Munich has said they're cancelling. So you immediately think, so they were organising for April, now organising for October. There's a strong chance that it won't happen in October. Can you imagine how demotivating that must be to re-cancel? So I would just urge, do as little reorganising without certainty as it's possible to do, and redefine your objectives and what you should be doing at this moment.
So I'd give like a practical reflection on it, and then sort of try to close my argument with a philosophical one. Imagine that you've been thrown on an island, and now you do not have any resources that you had access to earlier, but you still have to live. So you make do with what you can. Yes, we can spend some time in feeling sad about ourselves and sad about what we cannot do, and sad about how much we miss the running water and all the rest of it. But at some point, we might have to accept and adapt to what is the situation. So I guess it just comes down to this practical advice, I think. Make a list of things that are still under your control. Make a list of pockets of things that you can control. Then very firmly realize that you're not in charge. You might be in charge of your little team, but the context in which the team's working, you're not in charge of that. You absolutely have no control over it. And that's humbling, but at the same time reassuring as soon as you accept it. So once you've made a list of the things that can go as usual, start working on them. So I think it's just about the idea that, those affirmations that we say, give me the power to accept the things I cannot change and change the things that I can. But the philosophical idea behind all of this is that we should be able to laugh at this misery that we're in at the moment. The gallows humor is required. There was a time when there's a story of a French aristocrat when guillotine was invented in France. He's being taken to the guillotine his head to be chopped off, and he looks at the guillotine and says, "Are you sure this is safe?" So it's the idea is that to laugh at your situation when life is giving you this opportunity to laugh at your own misery, don't waste it by being angry at life. So that would be my closing thought, really.
When life throws you lemons, make gin.
Yes, exactly. That's the most British thing you could have said.
And very British.
That's great. So I have one last question for Teresa, actually. A couple panelists wanted to know what are the existing psychosocial services that are available to LGBTIQ staff members in the UN system, including UN Globe members. And also, do we have focal points in the various organizations and duty stations that you work with in relation to mental health services?
Yes, so the services that are available are vary depending on the organisation. So most UN organisations have their own counsellors, and that information is available through your organisation. We also have the critical incident support unit, who have counsellors for the Secretariat and all of the AFPs across the field. So I can certainly make sure you've got those details if you need to go forward. There's no specific services for LGBTI people, but obviously the counsellors we have a broad range of experience in different areas. And sorry, what was the second part of that question?
Whether you have focal points in the various organizations or duty stations, HR departments, et cetera, that you're working with in the various organizations.
I do. So I work with people from all of the different UN organisations, and it does mix. So it is very much a multidisciplinary approach. So some are in HR, some are our counsellors. We've got ombudsmen, we've got staff unions, we've got the medical directors in there as well. So, and sorry, no, so I have focal points in most organisations. Some of the smaller ones don't. But we all meet monthly and really look at what can we do across the system. Looking at ensuring that every organisation is starting to actually implement the strategy, speaking to from the Secretary General down to the CEB to HR Network for all UN organisations to be implementing the mental health strategy, and particularly at this time looking at. So if there's particular issues in your organisation that you feel we need to be mindful of as well, again, we've got the MHS email address, so really happy to hear from anyone who's got particular advice or feedback as we go through.
Okay, thank you. That's the end of our questions, and I think also the end of our time. So Nanu, I'll hand it back over to you.
Okay, thank you very much. Well, on behalf of UN Globe, the board, a big thank you to Deepak, to Simon, to Teresa for giving up your time today and sharing your experience, your skills, your knowledge on a very important topic to us. Especially to Simon and Deepak for giving up your time. Normally there's a fee behind this, and so thank you very much for sharing your time pro bono. I just want to acknowledge that a lot. To Teresa, this is just the start of our journey. Look forward to collaborating more with you on the mental health implementation and the strategy. To all the members who participated today, who joined us, big thank you for taking your time out and joining us. Please don't forget to reach out to UN Globe as well as a resource. We're here for you. Make us work, and we'll be happy to support where we can. And if we cannot, we're happy to refer you to the relevant people, or the right people that you can talk to. As a follow-up, we'll be sharing this webinar onto our website. A couple of agencies have requested this to share the link with them. And to Deepak and Simon, please happy to share your resources with an email that we can send out to all our members with a recording of this webinar. And a big thank you from my side personally to the board, to Sonia, Gabe, Jennifer, and Sophie for the support in helping prepare for this, and to IOM as well. So thank you. Again, if you're not a member already of UN Globe, please do register, www.unglobe.org, and click on join us. I will see you, hopefully we will see you next week for another session, for a follow-on session on creating safe spaces and keeping well next Tuesday at an earlier time, I think by 1 hour. So today was at 4 p.m. Geneva time. It'll be 3 p.m. I believe next week. Those who did register, or I'm sure you're not here now, but those who registered and didn't receive the invitation, apologies. Please check your spam folders, etc., etc. We don't know what happened there. But this was our first webinar of many to come, as I said, and you can always improve in terms of technical logistics. So again, a big thank you to everyone, especially our panelists. So thank you very, very much, Deepak and Simon and Teresa, for your time today. Looking forward to next week's session on Seen, Heard and Equipped. Thank you. Goodbye, everyone.
Thanks.
Thank you very much.
Thank you. Bye-bye.
Thank you.